Chances are you have probably heard about whooping cough, but maybe don't know a lot about it. So that's what we're going to get into in this video today. I'm Dr. Katrina Coulter. I'm an infectious disease physician and I make educational health videos. So if you find this helpful, please subscribe or like or share this with a friend or leave me a comment so this can reach more people. At the time of the recording of this video, we are seeing increased rates of whooping cough in the United States. And this is late September, early October. So this is something that does typically tend to tick up once kids go back to school. Whooping cough is caused by a bacteria called Bordetella pertussis, or sometimes we'll just call it pertussis. This only causes infections in humans, although there is a Bordetella bronchiosepticum that can cause a coughing infection in dogs, also known as kennel cough. So that one rarely gets into humans unless you've got your face too close to your dog. So maybe think about that. This disease, when I learned about it in training, we called it the 100 days cough. And that's really no exaggeration because the duration of this illness can go on for up to 12 weeks. So this can be really long and drawn out and annoying. Whooping cough typically starts out just like a common cold, but colds are usually caused by viruses and this one's a bacteria, so it's going to act a little different. So the beginning usually looks the same though. You've got a runny nose or maybe a stuffy nose, a little bit of a cough, maybe a low-grade fever, like less than 100.4 degrees Fahrenheit, not usually a high-grade fever. That's going to occur for the first 1 to 2 weeks, which we call the catarrhal phase. And then it evolves into the paroxysmal phase. And the paroxysmal phase can last anywhere from 1 to 6 weeks, sometimes a little bit longer. So that's when we find the classic symptoms that give this disease its name. People will have paroxysms of cough or coughing fits where they're kind of triggered and they can't stop. And then they cough so much that they have a post-tussive emesis, or basically they cough so much that they vomit. So these are classic findings of this disease. And then the last one is that in these coughing fits or paroxysms, there'll be like an inspiratory whoop or a whooping sound that the coughing person makes, giving this disease its name. So what can happen if you get this and you have a severe case? Well, in those paroxysms of coughing, you can cough so hard that you have urinary incontinence or you pee your pants, which is no fun. Or you can cough so hard that you break a rib or you cause a hernia or hearing loss or even carotid dissection, or you burst a hole in your lung called a pneumothorax. So these coughing fits are pretty severe. So this disease is best treated if it can be diagnosed in the first 1 to 3 weeks. Antibiotic treatment is available for this disease, and that is recommended for all people within the first 3 weeks of symptom onset with the cough. There are some special populations that we will continue to treat with antibiotics up to 6 weeks, and those are going to be our pregnant patients or patients that have underlying lung diseases like asthma and COPD, or that are immunocompromised or older than 65 years. So please, if you think you have whooping cough or you've been exposed to whooping cough, reach out to your medical provider to determine if you have it and if you need treatment. It is also highly infectious. And so if we know somebody has been exposed, we do prophylax them with antibiotics. So that'll be all household contacts and also those high-risk populations that I mentioned earlier. So there is treatment available. It works best if it's given in the first 1 to 2 weeks. It can usually shorten the duration of the cough, so you're not coughing for 100 days. But if it's given after that, it can still decrease infectivity. How do you prevent this? There's a vaccine, hooray! So this vaccine is highly effective and it is part of our childhood vaccination schedule. The problem is that immunity wears off after about 5 to 10 years of getting this vaccine. So it works really well when it's fresh and new. And the way a vaccine works is by giving your immune system a sneak preview to something it's never seen before. Specifically this one, which is the Tdap vaccine, which stands for tetanus, diphtheroid, and acellular pertussis. The acellular pertussis is pieces of the bacteria. So your body gets a sneak preview to these pieces of bacteria that are not dangerous to you. So it helps rev up your immune system. But after about 5 to 10 years, your immune system kind of forgets about that. And so you need a booster to remind it like, oh, hey, this is out there still and can make you sick. So before vaccines were available, we largely saw this in children under 10 years old. But since the vaccine era, now half the cases are in adolescents and adults. So the CDC does recommend that you have one booster as an adolescent or adult. And then if you're pregnant, you would get another booster when you're pregnant and they want to give you that Tdap vaccine. It's not for the tetanus, it's for the pertussis, because newborn infants are highly susceptible to this, and that's where we see deaths. So this has a really low rate of causing death in adults, but in infants it's higher. Again, we can prophylax somebody that's had an exposure, or you could prevent it by getting vaccinated. All right, that's all I have for you today on whooping cough. Hopefully you haven't had any exposures. And if you found this to be helpful, please give me a like or leave in the comments other topics you would like to hear about. Share this with a friend, subscribe, and that will help me get in front of more people so we can provide useful health information.